Hello everyone. So today we'll be studying the clinical features of molar pregnancy. So first of all, we'll divide it into symptoms and sign. So speaking about the first symptom is vaginal bleeding. So it is the most common symptom. Now it occurs in 46% of cases, and vaginal bleeding, if it is excessive, can lead to anemia. Anemia occurs in only 5% of patients. Now, why does this vaginal bleeding occurs? Now, bleeding occurs because molar tissues, it gets disrupted from the decidua, and therefore it also disrupts the maternal vessels. And if there is large volume of retained blood, it can lead to what? It can lead to distension of the endometrial cavity. Now speaking about the second symptom. Now second symptom is what? Second is amenorrhea. Amenorrhea of varying months. It can be 1 month, 2 months. Again, number 3 is abdominal pain. Now abdominal pain is of varying degrees. What are the reasons behind the pain? So number 1 is the uterine overdistension. Number 2 is the concealed hemorrhage. Number 3 is onset of uterine contraction in an attempt to expel the mole. Number 4, there can be chances of invasive mole. Now, next coming to the constitutional symptoms. Now, what are the constitutional symptoms that occur? So, number 1 is the hyperemesis gravidarum. So, hyperemesis leads to what? Hyperemesis can lead to electrolyte disbalances. And it occurs in how many patients? It occurs in this hyperemesis occurs in 8% of patients. And why does hyperemesis occurs? It occurs due to increased beta HCG levels. Speaking about our next constitutional symptom, so the patient becomes apparently very sick out of proportion. Number 3, without any apparent reason. Number C is that patient can have symptoms like breathlessness, that is dyspnea, or there can be tachypnea, there can be tachycardia, there can be chest pain. And why all this occurs? It occurs due to pulmonary embolization of the trophoblastic cells. And why does it occur? It occurs in patients with excessive of beta HCG level. Number D is the thyrotoxic features or thyroid storm. This occurs due to increased chorionic thyrotropin. Next is expulsion of grape-like vesicles per vaginum. And number 7 is the history of quickening is absent. So these are all the, in short, the summary of the clinical features, which is a very important thing to know in our PGT days, and it's a very important clinical viva question as well as a theory question. So we should know it, and thank you.